Welcome to the Restoration Psychology Podcast. In today's episode, Jason and Dr. Pei interview Dr. Michell Temple, who shares what it's like to be a woman of color in leadership, about protocol-based therapies like EMDR, and how being a counselor and an actress are more similar than different. Don't forget to like, share, and subscribe, and we hope you enjoyed this episode.
To the weary, the hurting, and the hopeful, welcome to the Restoration Psychology Podcast, where we invite you to rest, heal, and restore. My name is Jason. With me today, I have Dr. Michell Temple.
Hi.
And Dr. Jessica Pei. Hi. This episode is largely going to be interviewing Michell. I have Jessica here with me, largely because Michell Temple intimidates me.
Okay. I am so curious.
Intimidation comes in all kinds of different factors. Intimidation could be like using, an abuse of power or an abuse of authority, or it could be like an honor, respect kind of intimidation. Mm-hmm. The honor and respect kind of is the way that I am intimidated by you. Your just breadth of counseling knowledge, the research and literature that just astounds me. Mm-hmm. And even as I started to think about questions to ask you, I told Dr. Pei, I don't even really know what questions to ask her. So that alone is just like, oh man, I'm intimidated. And so I'm sure there are other factors that go into my like honor and respect of you as well, but that certainly is one of them, and I just have a great respect for you.
Thank you.
So even sitting down with you, I'm like, I don't know the questions to ask her.
But I want to echo that too. I think Michelle is Dr. Temple is one of the most brilliant human beings I know,
so kind.
And is so humble. Because I think oftentimes she's like, "Have you read this research paper from this year?" And I'm like, "I don't remember." And then she refreshes my memories. Yes, her recall, but just presents with such humility and grace and kindness. So I am so proud and honored to know you and work alongside you. So yes.
Yeah, what she said.
Okay. Yeah, well.
We're going to get into this a little bit. The other thing, another aspect of what the honor and respect I have for you is the different areas that you're involved in. And we'll talk a little bit about that in a bit. But before we get to that, just tell us a little bit about yourself, whatever you want to share.
Okay, sure. First, I do thank you both for your kindness. And it's important for me to say, even as I tell a little bit about myself, that I truly believe nothing in my life has been wasted. Mm-hmm. So as I interact with you, that might be what you are noticing, because I try to show up with all of me.
Yeah.
Yes. And so that might be what you are experiencing. And so Michell Temple. Temple is my married name. I'll be celebrating a whopping 23 years of marriage this year. And so I've officially been married. I won't tell my age. And so
that's longer than the office manager has been alive.
Yes, rumor is. And so I've been in counseling for about 20 of those. It will officially be 20 years in September that I've been in the field of counseling. I transitioned into counseling from teaching. So I taught for about 5 years in K-12, and I taught theater there. And so my capacity to, I think, remember things is deeply embedded in my time in theater. And I did theater from high school. I got a couple of degrees in theater, I'll admit it.
A couple.
Not just one.
Michelle has many degrees.
Many degrees in theater. And then after that, again, I transitioned into counseling. And getting into counseling, wow, that was an interesting journey, which I know we'll eventually talk about. And so I've been in Denver since 2021 to teach full time. And so coming to Restoration was a bonus. And so I teach full time at Denver Seminary. I hope it's okay that I say that, where I teach in the PhD and master's program in counseling. I also have the privilege of serving as an endowed chair at Denver Seminary.
That's a big deal.
You guys are all becoming intimidated.
It's the Vernon C. Grounds Endowed Chair of Christian Counseling, which is it started in 2 years ago, I believe. And so that's a little bit about me. And I'll just say this. I had a faculty when I was in my MA program. His name is Roger Weed. I think he's still alive. You just never know. Sorry. You might want to cut that out later. Is that he used to talk about himself as a very matter of fact. And he would report that people would, to me, because we would talk about it, would receive his discussion about himself as bragging. And he would say, I'm not doing that. I'm just sharing information.
Yes.
And if the person you're talking to receives it as bragging, that's on them.
Yes.
And so I'm really just sharing information. So however you receive it, don't put that on me.
But I would like to brag about you for 1 second.
Don't put that on me because I'm just talking.
But I do think it's really noteworthy for people who are not in the academy. Being an endowed chair is a really big deal. Like, it's a huge deal. So you don't need to brag about you, but I will brag about you. That's really noteworthy to have a position like that.
It is an honor for the seminary to acknowledge my research agenda.
Yes.
And so.
But you've worked hard for that too and earned it.
I follow the breadcrumbs. I know I'll stop saying, I don't mean to minimize, but I really just follow the breadcrumbs. I go to what is next. And so
You know what I hear though in that is there's at least some measure, if not a large measure of faithfulness.
Oh my goodness,
to
yes.
Follow the breadcrumbs, trusting this is the way.
This is the way. Yeah. And it is I'll use the word scary.
Yes.
Because there's lots of ambiguity.
Sure.
Even though there is clarity, right? Because I know what's next, but that's as far as I know.
Okay.
And I receive that, at least I try to, with open hands. And I have not been let down yet. No.
So I heard you say, I think a second ago, you were teaching and then you moved into counseling.
That's right.
What got you into counseling, moving from teaching? Why'd you go into that?
Yeah, so I was teaching theater. And the way I tell it is students with disabilities were thriving in my classroom.
Okay.
And you name it. It could be a student with a sensory disability, a student with a mobility impairment, a student who was in the neurodevelopmental category, whether it was ADHD, a student on the autism spectrum. They were thriving in my theater classroom. And so I would have teachers coming to me going, what are you doing in there? They want to come to your class.
Wow.
They don't want to leave. And we never hear about misbehavior. What are you doing? And I'm like, teaching? I think. So
Maybe connecting.
and so that's really what made me curious about counseling.
Did you have a sense, sorry to cut, I'm sorry. Did you
No.
have a sense even then that like you might be gifted in that regard or something about you was drawing kids that way?
Yeah, no.
Okay,
So what happened was my personal life kind of went topsy-turvy.
Okay.
And I'm a praying woman, so I prayed. I was like, Lord, I don't know what's happening right now, and I think I need to do something.
Okay.
What do I need to do?
Okay.
And so what I presumed it was because things were going so well with students with disabilities in my classroom, maybe I needed to become a special education teacher.
Okay.
That's what I thought.
Yeah.
And so I did try following that breadcrumb.
Okay.
And life took another turn. And I met this chap, Roger Weed. Funny how he came up again. As I was planning to redirect where I think the Lord was telling me to go. And I found a rehabilitation counseling program at Georgia State.
Okay.
And I had a conversation with Roger Weed, who was the program director at the time, and I shared with him this basically the story that I shared with you.
Yeah.
And he was like, guess what? Our program kind of aligns with that in a way that you could help people with disabilities achieve.
Your breadcrumbs coming
That's
together.
right. Yeah. Achieve their personal and professional goals. And I was like, for real? There's a job for that? I had no idea. And so I followed that breadcrumb and I've never looked back.
Okay.
Yeah, that was like 2003. I entered that program and finished in 2005 and was provisionally licensed by 2006.
Wow. You carry a bunch of different kind of professional identities, as we were talking about earlier, like professor, teacher, researcher, author.
Yes,
yes.
I shouldn't be clapping.
I'll clap for you.
I'm so excited about that.
And counselor.
Yes.
What is it like for you to carry or kind of hold all of those professional identities?
So my initial thought as I hear that, it goes back to, I think, conversations I may have had with others in the office before. I feel full and plenty is what that's like for me. And it translates in my plentiness in my life with family, with friends, with work.
Yeah.
It's been a journey of being willing to allow all of those different roles to inform how I see and understand the world and be with people all of the time. I used to do that whole compartmentalized thing, right? Where I'm not that hat, this hat, sorry. And that was overwhelming for me. Some people can do that. But I have found that accepting those are all ways that I show up in the world has been liberating for me. Yeah. Sorry, I got to say it because it keeps rolling in my mind. There's this thing that's called ontological presence. It's an existential thing, which basically means showing up, right? As all of yourself. And there's a story behind that. But when I realized, wow, it's okay for me to just show up. That just made the world of difference.
Yes.
You know, as you say that, and it's like the second time I think in the last 10 or 15 minutes we've been talking, that's like the second time you've kind of come back to that. As you say that, my mind goes to, I think that's one of the reasons why I have a respect for you is my experience of you is that you show up genuine and genuinely yourself in any situation that I've interacted with you in.
That means
so it feels very true about you.
Yeah, that means so much to me.
Yeah.
It really does because I like myself.
Yes.
Right? And sometimes when, depending upon a person's context, when they perceive that they cannot show up as themselves, that penetrates, and I did use that word on purpose, right? Other parts of their life.
Yeah.
And it can show up as unhappiness. It can show up as just excessive ways of being. Yeah. And I am pretty moderate in all places, which is so nice, right? I really, really do like myself.
Was that a journey for you?
Oh my goodness, yeah, it didn't work out. Oh my goodness, right. And I hope, and I keep saying, I hope it's okay that I say this, but as I grew up in the southeastern part of the country, and so Florida, Louisiana, Georgia is where I got married. And though that part of the country has progressed politically, socially, historically, it is what it is. So racism is a thing, right? And so I did not really grow up being okay with being a chocolate girl with big lips, not what I saw in the media as far as what a woman's body or a girl's body should look like, or because I can be loud and boisterous and all of the things. And so it was a journey. And it feels good to be here.
I bet it does.
Yeah, feels real good.
Before we jump into any specific like counseling methodology questions that I have for you, I want to ask both of you. You're both strong women, both women of color. What has it been like to operate in different leadership circles that you've been, invited into or asked to be a part of? And particularly both of you were probably, I've heard people describe you as like intimidating. What is it like to be on that end of, I almost said intimidating people. Like, what's it like for each of you to be on that end, and what's that experience been like for you? Sorry, I know it's a bunch of different questions, but you take that where you want.
Yeah, I'll let you go.
Well, one thing that, as Dr. Temple was sharing, is that she said like there was not a lot of representation for people who look like you on media. And I think that that's been a probably pain point in my own story, is that there haven't been a lot of women that went before me that are women of color in leadership. So sometimes it has felt like I'm the first one. And as good as it's been and as beautiful as it is, it's been really painful because there are opportunities for people to misunderstand me. Yeah. And I think as human beings, our biggest desire is to be fully known and fully loved. But sometimes, and where I've come to land, is that it's usually other people's insecurity that gets projected onto me. And the thing I'm still learning is that I just have to be me, regardless of what people think or believe, because if they truly get to know me, I'm positive they'll like me.
You are so likable, I tell you.
Thank you.
Yeah, I often tell people that what makes restoration good for me is having a leader that I can show up as myself with.
Thank you.
And that's not always been the case for me because of the question that Jason has presented. I'll say as a fellow, strong, confident, whatever words we want to use that people may describe us, it's nice to be in the presence of someone like that who doesn't need other people to be smaller.
Yes.
Right?
Oh, yeah.
You show up and be all of you.
That's right.
Yes.
To occupy space with you. And so thank you.
Oh, I'm so glad you say that, because that's so important to me, because I think much of my life I felt like I had to be small for the sake of other people.
Yeah.
Oh, that's making me tearful. But I think my greatest desire as a leader, oh, Michelle, what are you doing to me? Is to allow people to be fully who they are, like fully who they were born to be, made to be, and that there's no need for us to shrink back, that if we all just leaned into our own gifts and talents, that we can make so many beautiful things. And I think that is why restoration or working here has been so great, is that every one of us is a little bit unique and different. And that's just like such a beautiful thing to come together. And I think in leadership, that is what I've learned, is that we don't need to shrink back. We don't need to be less of ourselves. I think one time Michelle kind of shared it. Sometimes I'm like so fearful that I'm like too much, like, and I'm not like, people have said like, you're too smart, you're too ambitious, too this or too that. I'm like, oh, that's, maybe I should be less. But I think where the narrative that is shifting because of Dr. Temple is like, oh, you're plenty. You're not too much. You're plenty. And I think as I've learned how to embrace that for myself, it gives space for other people to be able to do that too. And like, I had to do my own inner work to do that. So I actually, when people would say that I'm intimidating, I'd literally walk around and flip my hair and be like, but I'm so nice. Why would anybody say that? I'm like, so nice. Okay. Yeah. But I came to the conclusion that I'm actually not nice, because nice means agreeable. I had looked it up. I was like, am I nice? But I think there is a difference between a nice woman and a kind woman.
Yes.
There's strength and kindness to who I am, even though I'm not always agreeable. I have a lot of opinions, but
opinions
I am
are good.
Yes.
Yeah, opinions are good. And I will say, as you say that, and then as I think about my journey, is about this idea of abundance.
Yes.
As a leader, and I do have an abundance mindset. When I hear people talk scarcity, like there's not enough, I'm like, Now, I also have to admit that's deeply rooted in my Christian faith,
Yes.
too.
Yeah.
I have to admit that. And so, anyway, so because I think I have an abundance mindset, working when I am in a position of formal leadership, I have found that it takes time for all persons to adjust to that. Because usually my response is, no, we can't do that. It's, yes, we can. We have to work together to figure out how.
So it takes people a while to respond to an abundance mindset.
That's right.
Yes.
And this idea of, it's also a biblical term of co-laboring toward abundance together. And so that means that, yes, I am the leader, but guess what? I don't do all the work. Right? And no, even as someone who I might supervise, it doesn't mean you do all the work either. Right? There's this idea of mutual responsibility. Yes, we have different levels of authority, right, in that. And you have yours and I have mine. And that takes time for people to adjust to as well. So what has that been like for me as in leadership roles? And I think I shared this with you. I have a tendency to occupy predominantly white spaces and predominantly white male spaces. And so it has been, some of those experiences have been redemptive, where I can show up fully as myself, and my colleagues are open, and we can have, I call, robust conversations, because I got lots of opinions. And I usually can find somebody empirically who agrees with me, which either way. And again, I say that also recognizing that there is some fallacy in science, right? So that's the other part. And so it has been positive in some regards, and it's been quite unfortunate in others. But because I have an abundance mindset, I don't think twice. I tell my husband the only person I am married to is him. So I have never had any issue about leaving a job. I don't care what kind of title I have. I don't care what kind of money I'm making. Whatever. It is only a job. That is all it is. And the Lord will supply.
That is so good.
And we laugh about that, because I was like, I don't worry about the money.
Meanwhile, I'm like, let's keep the lights on. What do we do?
I do not.
Well, thank you all both for talking about that. A couple of counseling kind of methodology questions. What is protocol-based therapy?
Yeah, sure. And I can actually connect that to everything we've already been talking about.
Of course you can.
Because again, I really do not perceive that nothing is wasted. I think everything that I have been influenced by, I've been exposed to, has some way shown up in my life now. And so I used to do theater, right? And with theater, there's this thing called a script and lines. And so a protocol therapy is basically an intervention that is administered according to prescribed guidelines, right? So basically what that means is that there is a way that is pre-established about how the therapy starts. There are pre-established steps about what happens during therapy.
Okay.
And then there are pre-established steps about how therapy ends. So it's almost like a script, if you will, for a therapy.
Yeah. So you kind of have like there's a roadmap.
There's a roadmap.
Okay.
Yeah. That's a good word.
Okay.
Can you give us some examples of protocol-based therapies?
Oh, sure. So, and I'll share ones that I use specifically.
Great.
So many people have heard of EMDR, which is eye movement desensitization and reprocessing. And then we add the word therapy. Then there is cognitive processing therapy, also known as CPT. And then I use strategic trauma and abuse recovery, or STARS. Those are the three main protocol therapies that I use.
Let's jump into EMDR for just a moment. What is EMDR, and why might someone choose that as a therapy?
Sure. So EMDR is one of the most research-based therapies, and that's the other thing that's important for me to say about protocol therapies, is that they are typically backed by extensive research. Typically, these things that are called RCTs, randomized controlled trials, which basically means they're experimental, so they can speak to causation.
Okay.
Right? So I did this and this is the outcome.
Okay.
And they basically say this therapy helped us achieve a particular outcome. And so EMDR is an integrative therapy that uses bilateral stimulation to help the client reprocess traumatic or traumatizing material that has, I'll use this word, hijacked their present experience. So that might look like a client or a person who tears up as they recall a particular life event, or they are easily angered by certain words, phrases. Anxiety can be a part of that as well. So that's the simplest way to think about EMDR.
Okay. I have heard, and I want you to correct me if I'm wrong here, right? I have heard that for EMDR, the closer you can do EMDR therapy to the event, the more, what's the word I'm looking for? The more benefit it has. Is there any research to that?
I think the best way to answer that is to say EMDR, the developer, Francine Shapiro, she has passed, and the research that continues indicates that there are different timelines and strategies to process material based on when it occurred. Okay, so we do have what's called a recent incident protocol with EMDR, which is slightly different than our standard protocol based on material that is older per se. So I can't say yes to that. What we know, sorry, I always do that. What we know, or what we think we know, is that recent material, we need to process it differently. And I didn't say this, but what the goal of EMDR is, as a person is reprocessing that material, the goal is to help a person use those emotions, those thoughts, those feelings more efficaciously based on their total life experiences. So, because sometimes the theory is that when bad things happen, we don't always integrate them with our life, right? We kind of, I'll use that word again, compartmentalize them. And what EMDR, the theory suggests, is that that's not helpful. What we need to do is integrate and metabolize. And when we do that, we can use the totality of our experience to make sense of that traumatic event. And the bilateral stimulation of EMDR expedites that process.
Is there a story that you would feel comfortable sharing where you've seen or experienced EMDR work for someone?
So what I'll say, no.
Makes sense.
No, is that I'll say things this way. So EMDR can feel like this kind of mystical experience for people because it doesn't require excessive verbalization of what has occurred.
Okay.
What it requires is a person's willingness to remember and watch or think about what they experienced like it was a movie, or if they were sitting on a train or even on a plane looking out the window and things passing
just
by.
Go by. Okay.
Right? And as they do that, and the therapist is using the bilateral stimulation and the protocol, what often happens is that as the therapist, or I, because I'm usually the therapist, is checking in with the client, they'll notice how the scenes and their experience of the scenes evolve and change.
Okay.
And as it changes, I've shared this with Dr. Faye, they have this almost like a sense of surprise because what material, which was once so overwhelming for them to even think about, they bring it to mind, and there's this calmness that they start to feel, and they're like, what just happened? And I usually go, I don't know what just happened. And they're like, I'm thinking about it, and that usual, say, increased heart rate, it's not happening. The desire to tear up, it's not happening. I don't even feel nervous. And I'm like, are you sure? Is usually what I say. They're like, I don't know. And we do some more bilateral stimulation. And so what usually happens is that a person's body, we say the brain does the work. The brain does the work, and they're able to adapt to that traumatic material in a way that they often think they never could, right?
I imagine as you were sharing that, for many of them, they get to that place of like, whoa, because they have imagined, like, I'm never going to get there. They
have imagined it. And so, and EMDR, because it is a protocol therapy, as long as the therapist follows the protocol, so I need to say that, they are protocoled for a purpose, to get as much as possible the same outcome. Most clients have that experience. And it's kind of, I like it because I like for stuff to work.
But you see it work right before your eyes.
And I see it work. And I have to admit, it has not gotten old for me yet.
That moment in the counseling room where you see someone like, get it, or
qualitatively, or they have a level of insight that they've never had before, and then it translates into, I'll use the word somatic, so a physical presence of calmness that they have not experienced before. I call it my hallelujah, thank you, Jesus moment. That's what I do. And Dr. Pay has seen me come out, oh, it happened. And so, because I do feel that joy with a client when they have those moments. Anyway.
Thanks for sharing.
This is a hot take question, okay? But is EMDR the only treatment to help people who have suffered from trauma?
Oh, no. No, of course not. And I think, like many therapies, EMDR can trend.
Yes.
Right?
It's trending now. That's why I ask.
It can trend. I mentioned two others that I use. And EMDR is also mistakenly presume to only treat trauma. And that's not true either. It is, when I tell you the amount of literature and RTCs that are done on EMDR for anxiety, depression, chronic pain, and there are associated protocols with it. But no, it is not. And what we know, there were these whole psychologists and psychiatrists back in 2010. Sorry, I'm doing it.
Yes,
okay.
do it. Right. The audience will appreciate it.
Right. Yeah. And they published this book on the common factors. Remember those? Right? The common factors of psychotherapy. And they looked at all of these therapies and asked the question, what makes them work? And they said, one, they all work, right? For all types of presenting problems. And then they said what makes them work are things such as the therapeutic relationship.
Yes.
That the therapy can provide the client with a rational explanation about their problem. And then provide, I'll use your word, a roadmap. How does the therapy provide a roadmap to resolve the problem, right? And then how does that therapy help a person live better? Most therapies do that.
Yes. Yeah.
Right? And so no, EMDR is not the only therapy to treat trauma. Does it align with the common factors? Yes. But so does your standard talk therapy and any other therapy. Yeah.
Okay, I have a bonus question for you.
Okay.
In theater, when you were doing theater, what was your favorite role that you played while doing theater?
Yeah. So two come to mind, and I get a little sad as I think about both of them because a lot happened in 2010. I keep dropping that year. Wow. The last show I did in 2010 was one of my favorites, primarily I think because it was the same show that I read that brought me into theater.
Okay.
It was For Color Girls Who Have Considered Suicide When the Rainbow Is Enough by Ntozake, Shange, who I happened to meet one day, actually. Who I happened to meet at some conference that I went to. But so that, and then Brigadoon.
Yeah.
You remember Brigadoon? Yeah. And so Brigadoon were my two favorite shows that I did. So one purely musical, and then actually, you know what? I actually really liked Agamemnon too. So I used to do lots of Greek theater. So Agamemnon was one of my favorites. Yeah.
When I was in theater in college, I did Antigone.
You're
making me remember that.
Yes.
Going back.
And so I think those were my three favorites. For different reasons. Agamemnon, because of the anguish of that particular play. I sound a little melancholy now that I think about it. For Color Girls, I think because it resonated with my own journey so much. And then Brigadoon, because I was actually cast in, I was a female in a historically male role that just made sense for me to do it. Yeah. And so...
You said melancholy a second ago. As I'm watching you talk about this, though, what I see is a reflection on things that have been impactful to you. Yeah. I don't so much sense melancholy. You might feel it.
I might,
but
feel
I sense reflection on things that were impactful to you.
Yeah, and I think there is some sense of is sadness the word? I don't know if sadness is the word.
Grief, as you
grief,
remember?
Yeah, some grief, as I remember, because I haven't done theater in a very long time. Babies happened. Life started lifing, and so it may just be that I hadn't thought about it, and those are just feelings of just loss that are coming up. Like, but I do. It does come up in my current work, not in the same way, but yeah, it does come up.
Thank you for joining us today. Thank you for talking with us.
Thank you for this invitation. I hope it's helpful.
Yes, I learned something new about you and psychology.
Yes, I did absolutely as well.
She's always here to teach me something. I love it.
But thank you guys for joining us for this episode. I hope you have enjoyed listening to these two amazing women talk, especially to you. Thank you so much
for you, Jason.
Being here, being a part of this practice, and for everything that you bring to this world.
Oh, you're kind. Thank you. Thank you.
Thanks for joining us, y'all.
Thanks for listening to the Restoration Psychology Podcast. Please like, share, and subscribe. If you're seeking counseling or have any other questions, please contact us at restorationspsychology.com.